Hey guys, welcome back to Inside the Mind of a Diva. I am Heather. Hello. I'm going to start making regular videos for my second channel. I think it is irresponsible of me to not give people information, so eventually to be out there and help people. I'm a medical shit show, and I think some doctors aren't educated. In my opinion, I think doctors should keep growing. You know, they don't stay the same as medical school. You learn from experience, and it helps other patients. It makes you a better doctor. So I'm tired, my primary almost killing me. I'm just saying. But I think people need to know the information. And so many people are like, Heather, make that video so you explain your symptoms and all that. Because my symptoms were, I was diagnosed, guys, with pulmonary embolisms. Extensive, small pulmonary embolisms. Both lungs, mainly my left. So what happens is I'm an autoimmune patient. And so many autoimmune patients didn't even know this. Okay, so when we're in flare-ups, our sed rate goes up, everything's a shit show, everything's a mess, blah, blah, blah. High inflammation in the body can cause blood clots. And I had 2 injuries on top of it. I fractured my cuboid bone. Some people actually do know this if they watch my first channel. And I tore my Achilles heel, which would make you stop moving. And with high inflammation, oh, that's a shit show. So, dude, my skin's on fire right now. It's because today's going to be warmer, my body reacts to that, don't ask. Anyway, that's a whole other video of small fiber neuropathy that I will let you guys know because people are wrongly diagnosed. Fibromyalgia is not an autoimmune. Please, for the love of God, please, 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 people need to be more educated. Autoimmune diseases are connective tissue and your body attacks itself. Fibromyalgia is overactive nerves. Not even the same in any way. But I digress. So what it was is, when I went through something hardcore, and again, if people watch my first channel, they would know, and I'm not going to give you guys, sorry guys, it's something on the freaking pillow, but I'm not going to give you guys all that information because 1, it's personal, 2, I have it on my members only spot on my first channel, and it would be here for a longer time. So we'll just say a really high stress thing happened in my life that caused PTSD, put me in a flare-up. The worst flare-up of my life. I feel like my primary is not educated enough to understand autoimmune diseases or common sense, I'm just saying. But how she missed this, I have no idea. So, as my sed rate was raising, I was getting injuries. Like, I would walk and I fractured my cuboid bone, for God's sakes. Tore my Achilles heel, which was the downfall from the cuboid bone, and it was on the opposite foot because I was stressing out the other foot. So I knew something was wrong. I could feel it. Like, it became to the point where I couldn't even walk anymore. Again, some of you know that I actually got a customized cane that's pink. Listen, if I'm going to use a cane at a young age, I'm going to make sure it's stylish. Just saying. But, okay, so here it was. My foot was not dark red, hot. First of all, I'm always hot, but dark red, hot, and whatever. No. Because I had inflammation through my entire body. I felt exhausted. I felt weighed down. I felt foggy in my brain. I couldn't connect words together, which is also part of inflammation. And I couldn't walk anymore. My foot was so swollen in the arch area and all of that, that I just couldn't walk on it. It felt like I was walking on a bubble. And my primary is like, well, I don't see that there's swelling. And I'm like, I don't know. And this is just my observation from her, the way she acted. She was so focused on my weight gain, which was inflammation. Yeah. She kept trying to put me on diet pills, which, girl, I'm glad I followed my gut feeling, guys. Like, I knew something was really wrong, and diet pills would have killed me. So she tried putting me on diet pills for months. Then she tried putting me on Ozempic, which I refused after 2 weeks of being on it. And, like, she was so focused on my weight. She's like, you need to lose weight. You need to lose weight. You need to lose weight. Normally, I'm a super skinny person, so she couldn't connect. So I don't know if she's ever had an eating disorder or anything where she harps on weight. But I'm normally, for you guys, if you watch my older channel, like, you would see I'm normally a really small, skinny person. Like, my bones stick out. So She just kept tarping my weight. I would talk to my therapist. I'm like, I feel like she's missing something. So what it felt like, guys, is besides my swollen feet from hell, and I couldn't walk anymore, and the pain was excruciating. When I would sleep, I would wake up with panic attacks. She's like, oh, it's probably just, you know, in your head. And like, dude, that girl needs to be better with life. But she was like, you know, blah, 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 and this other crap. She didn't think anything of it. Which it was pulmonary embolisms that were causing me to wake up in the middle of the night not breathing. So, like, this woman, man, I swear to God. Like, it's bad enough she told me it was IBS when my gallbladder exploded and I almost died. Literally almost died. And now she does this. So, yeah, she's cold and cough from now on. That's it. We're good. We're done. I'm going to try my best to find a better primary because she's not good. But, you know, she gave me Ativan. I took it at night, which made my life a whole lot easier. But she also didn't realize that my blood pressure is normally low. When I mean low, I mean like 100 over 60 or 90 over 50, or it's low. My blood pressure for the last year has been 150. She never even treated it either. 150 over like 100. Like, why she didn't think your body's stressing out, but you got to check your heart. Like, it was all these little things. But I noticed as far as me, I knew something was wrong. Like, when I walk everywhere. A lot of you guys know I'm super freaking active usually. I walk 10 miles minimum of day. Like, super athletic and all of that. And then all this shit happens. But my town is Oneonta, City of Hills. So just walking up my block, my heart would race insanely and I'd be out of breath. I'm like, well, maybe it's because I have high inflammation, I'm out of shape, blah, blah, blah. Even though it hasn't even been that long, but whatever. I'm trying to rationalize it. That's just who I am. I try to rationalize everything. I'm not a hypochondriac ever a day in my life. Even going through this, I'm still more of a positive person than most. And I'm telling her all of this, and she's just, you need to lose weight. I'm like, don't you think you should check other shit? Just saying. Like, she's like, well, no, I think it's just your weight. And I'm like, you know, you bring up my weight a lot. I'm like, when you know I'm normally smaller than you. So don't you think something's could be causing it? So I think people need to be aware that DVT clots happen. They happen with surgery, long flights, you know, if you're not active. And people don't get it. People that don't really exercise at all, you can kill yourself doing that. And it's not even just whatever. You can literally cause blood clots in your body. And people die at random and they do the autopsy and be like, oh, that was pulmonary embolism. And so many of my autoimmune doctors, my specialty doctors, like, you are so lucky to be alive. And I find it crazy because, like, a couple days before I ended up going to the hospital, I was talking to my grandmother that just passed away. Me and her are like white on rice before she died. So her dying unexpectedly from an asthma attack. Like, I don't understand why they didn't have her on a medication to keep it controlled, but whatever. I was like, Grandma, I need your help. I'm like, nobody's helping me. I'm like, I'm watching myself deteriorate. I'm getting depressed severely. Like, being active and mobile and being out there is what makes me happy. I love being outgoing. And then all of a sudden things got worse quick. And so I'm going to tell everybody what it felt like. So I took a probiotic pill, which helps healthy gut flu. I took it, and a few hours later, it felt like I had such massive gas. And what it felt like is it felt like I had like a hard burp sitting right here, but it would never come up. It would branch off in wicked pain going across my chest. So when that occurred, I was like, this isn't getting better after a couple days. Then that's when my rib pain on my left side my ribs are swollen. And my diaphragm. brings me back. Give me a second. And then all of a sudden, it felt like a boa constrictor was on the bottom of my ribs squeezing me. The pain was so bad. I didn't sleep for days. It was so insane. I go to the hospital, and I explained to the nurse practitioner who took my spot, who took my chart, and a nurse what was going on. And they look at each other, and they're like, well, with your oxygen number and your blood pressure is at 170 over 120. They're like, we're going to do some scans, we're going to do some blood work. So the one thing about my healthcare facility, it's called my Bassett, but they give you the blood work when the doctors get it. The doctor doesn't have to release it or anything. It just goes to everybody all at once. My D-dimer was over 3,000. And I know what D-dimer is. D-dimer is pulmonary embolisms. So I start crying hysterically. So the person that came with me was like, why are you crying? What is wrong? And I told them. And then they started to try not to cry. And I'm like, my whole life, all I do is try to take care of people. I do everything I can for me, everybody else. I put everybody first, and I just get ignored by doctors. And now I'm probably going to die? Like, this is freaking bullshit. So they did everything. I have sinus tachycardia. I have extensive, I told them I didn't want to know how many. Because I have generalized anxiety disorder. Homegirl doesn't want to know. But I have extensive pulmonary embolisms in my left lungs, couple of my arteries. And there's a few on the right side, but more on the left, which is actually pretty good news because the left side, it's better to have it on the left than the right. And that's a whole other detail that I'll explain later. But they did a CT angiogram from my diaphragm up. They did, they were fucking amazing. Explain to me how a practitioner can help me, and knew what it was almost immediately when I explained to her everything. But my primary only saw weight. Moral of the story, if you have a feeling, get your ass to a different doctor. If your primary is just blindsided and only sees one thing, go see another doctor who doesn't even know you, doesn't know whatever, doesn't know. They're looking at your thing fresh. They'll know almost immediately what it is. Now, February, I was diagnosed with epiploic appendicitis, which can happen if you're overweight, which I only just became overweight, people, and DVT clots. And I told my primary, I'm like, wait a minute, hold up. When she found out everything out, she's like, well, I had a feeling. I'm like, you had a feeling this was the issue? So why didn't you do anything? And she just looked at me. I was like, you almost killed me. Again. She's like, well, I've only had one patient with a DVT clot. I'm like, you've been out of med school for almost 10 years. And you're just as educated as you were when you left med school. No experiences of life made you better. Nothing. I'm like, you ignored me. Treated me like shit. Made me more self-conscious about my body. When it was you who fucked up. And by the way, I was hospitalized 2 days before my son's 17th birthday. My kids definitely are going through it right now. They're afraid, I might die. I try to stay positive for them. I was like, guys, I'm a strong person. Like, not much. Sorry, guys, I'm late. Not much things can keep me down. I'm pretty determined. I was like, just take one day at a time with me. We'll do whatever we can. And, hopefully in time everything just gets better. Now that we're aware of what's up. And, I keep them posted. I let them know everything that's going on. Which, by the way, guys, here's some shit. I got a DVT left leg scanned on Monday. Today's Thursday. Still never got the results. Blood flow, any of that. Checking my vein, anything. Never got the results, not once. But Wednesday, which was yesterday, I did my abdominal scan, got it within 4 hours after that sonogram. So yeah, I'm going to be going up to the doctor's office and chewing their ass out because I'm getting a little freaking tired of them not giving a shit. And many great doctors have left my healthcare facility because they're tired of the head people only caring about money, not patient care, not it's politics, all this other bullshit. They all leave and go better places, and I'm like stuck here with the shitty ones. But it's like, even now, I tell her she knew my symptoms of me being brain foggy and I can't find words and I can see them but I can't say them and blah blah blah. She's like, it might be just stress. I'm like, Mallory, this has been happening before the pulmonary embolisms and you know that. My son was here, brought him with me for proof because he was at that appointment. I'm like, because you only saw my weight, now you only see stress. I was like this before I knew what was wrong. Like, I'm just tired of her. So freaking fed up. So I'm just telling you guys, be your best own advocate. Know that symptoms can gradually build and you just feel out of shape or whatever, and you could save your own life. If you feel one of your doctors are not giving you the best care you deserve, get another opinion. Get another opinion. Because it could be just minutes and you can die. So people ask me what blood thinner I'm on. I'm on Lovenox, which is an injection needle thing that I do at 8:30 in the morning and 8:30 at night. I mean, people are like, oh, I can't do that, it burns. I've had worse things in life. So it burns when you first do it, but it goes away. I've had vaccines hurt more than that. So I'm used to doing needles. I do B12 injections because I can't hold B12. Like, I'm just, you know, as an autoimmune patient, you get so much blood taken from you. Needles don't faze me. They don't. At all. I do want to give you guys a bit of information. So for years, I've only had one good vein people can find. On blood thinners, all my veins are out there. They now can go to multiple sites on my body. So get checked. Do what you got to do. Simple blood tests can determine if you have blood clots or pulmonary embolisms. If you have swelling and pain in one leg or even in both, and it's just not normal for you, ask for a DVT sonogram. You could save your life. You guys know I'm a huge patient advocacy person. I try to give everybody the information because it could save their life one day. Even when you just run across my videos and be like, oh, I'm healthy, it could still save your life one day. Surgeries can cause this. Everything can cause this. So do the best you possibly can for your own self. If you feel something's off, it's better to be safe than sorry. And I'm all about helping people. That's what I have my Denture channel for. I've been doing that now for 2.5, 3 years, something like that. Definitely slowed down the last year or so. I haven't been doing many videos, only because Hello was sick. But this second channel of mine is Inside the Mind of a Diva. So I'm Heather B. Denture Diva and Inside the Mind of a Diva. So this is based on everything that makes me up, whether it's healthcare, autoimmune diseases, everything, makeup, skincare, the whole enchilada. Like, I don't even have a filter on, guys. Skin's on point. But it's everything that makes me up. And patient advocacy is so fucking important to me. It's so important to me. It is my gigantic passion because I know what I've been through. I've been shitted on by doctors. I've been ignored, and I've almost died many times because of that. And I feel like if we're more knowledgeable, it helps us fight for whatever care that we need. Because if we're not educated with it, how will we know when something's wrong? You know? But I'll always be here if anybody needs to talk. All my information in the description below. Arrow next to the title of the video. Click it. Do all of that, guys. If you want to know more about, I even do makeup routines and stuff like that. So if you want to know healthcare, what can help, what can save, what can do, makeup, skincare, how to know your skin type, how to do all of this stuff, subscribe. Subscribe, like the videos, comment, ask what certain videos you want to know. More than happy to do it. 100%. Even if I don't know about something, I always research the crap out of stuff. And I ask doctors that I know on YouTube and my specialty doctors because they're phenomenal. So I'm actually going to start seeing if they want to do some videos with me to educate people. Even if I save one life, that's all that matters. Because I wish I had that. And I don't. And I have to be my best own advocate. And if I only just knew. I suffered for almost a year. So if you guys ever need help, you ever want to talk, you ever need to vent, you ever need to know what direction, what blood work, I know my blood works, guys. You want to know any of this, just reach out. Drop a comment, private message me, I'm cool with that. Anything. Because we need to work together as a team. Because I feel like not all doctors, some doctors are freaking amazing, but some doctors or PAs or nurse practitioners think they know everything and they go by statistics. Well, you know what? My gallbladder exploded when I was 30 and I was healthy and fit. You can't go by statistics. Everybody's different. We are not a piece of paper you can go off a graph and a chart for. Everybody's different. Their body reacts different. Take statistics, throw them out, because that's bull. But if you guys ever need me, I'm here. I hope this video has helped somebody, and if they feel any remote the way I did, please go get checked. Insist on getting checked, or see somebody that will check you, because it can save a life. But I love you guys. Please stay safe and healthy. Certain videos, guys, you want to see, private message me or comment down below, and it'll be my pleasure to do anything you want to know. Because the more information out there, the better. But I love you guys. Keep advocating for yourself and don't quit or give up. Because your life is at stake. Later, guys.